Does less daylight get you down? If so, you are not alone. About 40% of American adults say their mood worsens in the winter, according to a poll by the American Psychiatric Association. And it could be something called seasonal affective disorder, also known as SAD. CBS News chief medical correspondent Dr. Jon LaPook is here to tell us how to beat it. And Dr. LaPook is here right now. You know, some people might call this the winter blues, but you say this is something completely different.
Right. The winter blues is a milder form of this, right? But like, what's affect? Seasonal affective disorder. Affect is your expression of your feelings, your emotions, your mood. And most often, SAD, seasonal affective disorder, refers to as you go from the summer months to the fall and the winter, gradually you slide into depression. Actually, less
real depression.
Real depression. I mean, less
diagnosable depression.
Diagnosable. Less often, it can trigger bipolar illness. And I found out last night, which I didn't realize, that there's actually another form which it can happen as you go from the winter into the spring and summer.
What?
But that's much less. And we're going to concentrate today on what happens in those dark days when people wake up, they don't want to get out of the covers. They're feeling sad. You know, it's real depression.
What causes it? Is it as simple as the light changed and we need light? As we hear some sirens here.
Yes, right. It's felt to be a disruption of your circadian rhythm, figuring out, is it day, is it night? You have shorter days in terms of how much light there is. There are theories about serotonin levels, these neurotransmitters and melatonin, but people don't really understand, exactly what causes it, but there is an approach to treating it.
I wonder if also, because we spend more time indoors during the winter, it's not just that the days are shorter, but our time outside is less, I would think.
Yeah, and that goes into one of, the therapy. So I think I really want to encourage people, if they find that year after year, it seems to be this rhythm where, the darker days come and they get depressed, that's like, okay, seek professional help, okay? You don't want to just say, I'm going to go out and treat it myself, because it can be serious, and you can actually go all the way up to suicidal ideation. So, get a health professional there. Of course, one of the approaches is these light boxes, or just getting out in the morning and being exposed to light, but there are these light boxes you can have. There are other approaches, so cognitive behavioral therapy, talk therapy, even antidepressant medication. But it's something people should take seriously.
Do you think the acronym came before the name?
I was going to ask the very same question. So what's the story with that?
So Dr. Norman Rosenthal from South Africa came here in 1984, described this, and he was sort of noodling it, and he thought, oh, that's kind of a clever name. People will remember that, and he's really a leader, and I would encourage people, as I did, to Google Norman Rosenthal and seasonal affective disorder. There are a lot of videos, and there are things that he's written a few books, so he's a big expert.
So it's good medically, but also great with acronyms.
Yeah.
Proven on both track records, winner.
Stellar.
Okay, Dr. Jon LaPook, thank you very much. Appreciate it. It's great.